For injection of plantar fascia, we'll first start with the posterior tibial nerve block. The probe is placed in between the medial malleolus and the Achilles tendon in a transverse fashion as seen. This image shows contents of the tarsal tunnel. This is the medial malleolus. This is the tendon of the tibialis posterior. It is pulsating, that is the artery. Can you just toggle the probe to see whether this is the tendon? Yes, so this is showing anisotropy. This is the tendon. This is your artery. Just release the pressure some more. Release the pressure. Okay, so it's a complex of artery and vein, and inferolateral to it is our posterior tibial nerve. I'm just going to freeze it. So you can remember the contents of tarsal tunnel as Tom, Dick and very nervous Harry. So if we go more laterally, we'll be able to see the hallucis longus tendon. We're not going to go into that. We have seen our area of interest. So we'll first give the posterior tibial block. We are now going to go in plane, keeping a close watch on the artery. So all the artery and vein is on the medial side, so we enter from the lateral side.
एक छोटी सुई लगे.
See, beautiful, you can see the needle entering, and now we will infiltrate. Beautifully, you can see the hydrodissection of the nerve, and that is a very nice infiltration. So in the long axis, she's kept her probe on the calcaneum. Okay, so this is the border of the calcaneum. Here the calcaneum steps off. This right above the calcaneum is the plantar fascia. This is the border of the plantar fascia. So now we are going to freeze it, and we are going to measure the plantar fascia exactly at this point where it is stepping off from the calcaneum. This is the thickness. We see it perpendicular. As you can see, this is the upper border. So as you can see, the thickness is almost 0.73 centimeter. The normal thickness is supposed to be less than 0.4 centimeter or 4 mm. So this is the transverse axis view. To identify the plantar fascia, we will try to move the subcutaneous tissue. So when we just give pressure, as you can see, the part that is mobile, that is the subcutaneous tissue. Below that, the firm part which is not moving, that is the plantar fascia. Okay, so we can see the needle entering from the medial side, which is the right side of the screen. We're done with the plantar fascia injection, and we have been consistently outside the fascia.